Hey there, Craig here from Elevate Chiropractic, and in this video we're going to talk about the ice versus heat debate. Now I'm asked about this all the time. Should we use ice or should we use heat with an injury or an ache or a pain? There's definitely a little bit of conjecture about this, but I'm going to try and break it down into a couple of simple things and give you some basic guidelines on when you should use which one and how long you should use them for. So hopefully it makes a bit of sense. I'm going to break this into two videos. I'm going to talk about ice in this video. I'm going to talk about heat in the next one, so make sure you stay tuned for that. But in the meantime, let's see how we should use our ice or cryotherapy. So in this video, we're going to be talking about icing. It's important to realize that when we are using ice, we're using it as a pain reliever or an analgesic. Icing does not promote healing or speed up healing. It's really used as a way of reducing the pain, making things a little bit more comfortable, especially in the acute phase of an injury. So you use ice when there is an acute or a fresh injury. If there is redness or swelling and signs of inflammation, then you can use ice. You have to be a little bit careful when you use ice for a muscular injury. If there's muscular spasm or trigger points, like most commonly in back or neck pain, ice has been shown to aggravate that a little bit. So you've got to be a little bit careful if you have back or neck pain when using ice, because sometimes it can potentially make that worse. But let's have a look at some of the more common ways that we can apply ice to an injury. So if you're wanting to apply ice, there's a few different ways of doing it. So let's have a look at some of the more common ones. So we've got our most common ways of applying ice. We've got our ice pack, which most people have in their freezer. If not, you can get them really cheap, reasonably cheap, and it's a really useful way of applying ice. You use your old trusty bag of frozen peas, veggies, whatever you want to use. You can even use like a Ziploc bag, pop some ice in it, and you can apply that to the area. And then of course, one of my favorite ways is using an ice cup like this. Okay, so you start off with a paper cup, obviously fill up with water, freeze it. When you've got an injury, you can then get your cup, tear off the top bit so you can hold on to the bottom part of it without freezing your fingers, and then you can rub that on or massage that on to your sore area. Okay, this is called ice massage or using raw ice. It's been shown to cool the area much faster, give you a faster cooling rate just because the mountain water goes into all the cracks and crevices and it works a little bit faster. But you've got to be a little bit careful with that, and we'll talk about that in the next bit when we talk about how long you should actually use the ice for. So how long do we apply ice for? My general rule of thumb is we're going to apply it for 10 minutes at a time. You're going to place it on the sore area for 10 minutes. You're going to take it off until the area warms back up again, and then you're going to repeat that as often as you like. If you are using an ice cup with that ice massage or raw ice, 1 to 3 minutes is going to be heaps for that. Okay, you've got to bear in mind that when you're numb, you're done. Which basically means that if the area icing goes numb, then you've used your ice for long enough, and then you can take it off until it warms back up again, and then repeat that cycle. So that's a basic rule of thumb to follow when you are using ice. So if we make this nice and simple, basic guidelines to follow if you're wanting to use ice. You're going to apply ice to an acute or fresh injury. If there's signs of obvious swelling, inflammation, those types of things, that's when you can use ice. You're going to place it on there for 10 minutes at a time, or at least until you're numb. Remember, if you're numb, you're done. You can do this for the first 24 to 48 hours. Normally, my usual approach to this is the first 24 hours, the first day, I'm going to use ice, and then I can switch to potentially heat, and we'll talk about that in the next video. Of course, there is exceptions to this rule, and one of the things I read when I was researching some of this stuff was if ice feels nice, it will suffice. So really it comes down to, does it feel good for you? Especially when it comes to things like sore back, lower back pain. Some of the research suggests that we shouldn't use ice because it can potentially make it worse, but if it feels nice for you, then by all means do it, but just do that 10-minute burst if you are using an ice pack, or a bit shorter if you're using the ice cup. So if you have any questions about this using ice, please comment down below. I'll do my best to answer those for you. I'm going to put a couple of links here to some blog posts I've written previously, which goes into this in a little bit more detail. So if you are keen on finding out a little bit more, please follow those links and read those blog posts. But until next time, take care, and I'll see you soon.